If anything, the last 2 years have shown us that it's time to put health first. For our people, for our country, and for our future. As the world takes stock of the impact of the pandemic, lessons have been learned. How do we take these lessons and apply them across our healthcare system? And how do we ensure that they bring about sustainable solutions? Today, we try answer these questions as we bring together some of the best and brightest minds from the South African healthcare sector and beyond to examine different areas of the health and wellness ecosystem. By engaging on the state of healthcare in South Africa today, we hope to offer a glimpse into an exciting future in which we can all support efforts to broaden access to healthcare and to strengthen our health system. Because together, we can share the burden, turning challenges into opportunities. Together, we can make a difference. Together, we can go much further. Working together, not just to survive, but to thrive. This is the SA Healthcare Industry Summit 2022. Brought to you by Afrocentric Group.
A very, very good morning and welcome to the SA Healthcare Summit 2022, brought to you by Afrocentric, South Africa's most extensive, diversified and seamlessly integrated health company. So, we all know for the past 2 years of fighting a global pandemic, our lives have really changed in ways that you and I could never have ever imagined. From social distancing to new ways of working, we have had to drastically change the way we interact with each other. Now, we don't know whether this will be sustainable in the long run. We're already seeing and hearing from our president how things are loosening up time by time. But I can tell you one thing, the more we get together, the more I realize how much I miss hugging people. And that's one of the biggest things, it really is. But we as humans should be together and not apart. And that is what we're working towards. But it was a tough time. And when it comes to our health systems, we saw them tested to the limits. While we do need to absolutely applaud the commendable tenacity and unwavering commitment of our nation's healthcare workers, we also need to reflect on how we can strengthen our healthcare systems while also promote access to affordable healthcare. So much of a spotlight has been put on the healthcare systems here in South Africa, obviously around the world as well. But we can't let these lessons go by without learning from them and fixing what we need to fix. And today, we are here to do exactly that. Well, my name is Leanne Manus. I have been looking so forward to this event, I can't even begin to tell you. When you see the lineup of speakers that we have, when you see the panel discussions that we have, and the topics that we're going to be bringing you today, I think you're also going to understand why I am excited about that. So discussing and ultimately reform and help reform our healthcare system. That is what we're hoping to achieve today. Also, later on this afternoon, we'll be hearing from our Health Minister, Joe Pahla. Looking forward to that address as well. So good to be hearing from him. That'll happen after lunch. But don't worry, I got you covered. I'm going to talk you through absolutely everything as we go along today's broadcast. So, besides the Minister, we're going to be hearing from a load of the health professionals that have been looking at this pandemic for us and the lessons that we're going to learn that we can use to transform the health industry. So, before we even get into anything right now, I want to kickstart the proceedings, and I have the honor and privilege of welcoming the chairman of the board of Afrocentric Group, Dr. Anna Mohokong, and of course the company's group CEO, Ahmed Bandaker, who will briefly discuss with me the importance of the summit. It is so good to be with both of you. Welcome.
Thank you.
Thank you. I mean, this is a lot of work in planning. I mean, this is the first time. This is the inaugural summit. Ahmed, let's begin with you. Putting something like this together, it's not the easiest thing, I imagine. However, seeing the fact that we're here, it's happening, we're live. What's gone into putting this together?
Thanks. Good morning, Leanne, and good morning to all the viewers that have connected to join us today as well. So it's been an interesting journey, as you know, over the past 2 years. You've said this in your opening remarks about what we've been through during COVID. And as we know, it was in August 2019, in fact, when the NHI bill was tabled in Parliament. No sooner was that tabled were we then faced with COVID. So while so much has changed, so little has also changed. And that's where we started thinking about this as a company and thinking about the things that we need to do to be able to get the conversation going, get the dialogue going about how to achieve true disruption, true transformation in this healthcare industry. And we're talking about this for the 50 million South Africans, right? Or the 60 million, not just those that are insured. We have to look at the lives of the uninsured as well. So COVID has taught us a lot. COVID has seen us get together, both in public and private sector. And while we might not always have agreed on certain aspects, but at the end of the day, we pulled all together and got ourselves through it to the point where we are now. And last night, listening to the president, obviously with relaxing some of the level 1 restrictions. So this summit that we've put together is really about us having the right conversations with leading experts that will give us some guidance in terms of the way forward. How do we take a forward-looking approach based on what we know? I think it will be a travesty, Leanne, if we go ahead and just assume life as normal or the way we had it before, when there's so much that we've learned, and there's an opportunity now to make a deep impact, to revisit some of our decisions that we've made in the past and build onto that.
Now, this, of course, I mean, that's what we're really looking forward to, is actually, getting these ideas out there and seeing where we can work together to make this better. And that's what I'm really looking forward to today. Dr. Anna, as we know, you are a doctor. That's what you do, and one of the founders of the Afrocentric Group. Aligning your brand with the SA Healthcare Industry Summit and being obviously the headline sponsor for this, how does it work together? What attracted you to this?
Thank you, Leon, for the question, and good morning to the participants of the summit. Thanks also for hosting this event.
Such a pleasure. I'm looking forward to it.
Indeed, we are living through the vision we had from the onset, hence our facilitation of the event. It's good for us and great for us as healthcare workers, for us post-COVID, to engage once more on pertinent issues that affect us as a nation, particularly around healthcare. As the Afrocentric Group, we are committed to enabling access to quality, affordable healthcare. It is a commitment that is also in line with a global imperative, that is Goal 3 of the Sustainable Development Goals, to achieve universal health coverage, including financial risk protection, access to quality, essential healthcare services. And as we went along, we refined the model to also include access to safe, effective, quality, and affordable essential medicines and vaccines for all. This commitment has been at the heart of everything we do since our establishment in 2008, because we recognize that a healthy population is the foundation and the cornerstone of our economic development. We have been driven by one singular purpose: to enhance the quality of life by innovating a new integrated model of sustainable healthcare that measurably improves access to quality healthcare. Over the years, we have built an organization that has proved itself time and time again that it is certainly well positioned to achieve this purpose. Hence today's event, for example. And as for, Leanne, let me say to you, as a true patriot, because I'm a South African, and I'm going nowhere. This is my country. I was born here, and I'm going nowhere. I'm going to live in my country forever. I'm driven by the spirit of Ubuntu and empathy for my fellow citizens, and will ensure that we reach every crevice of the country, of our nation, to reach out and serve our people when we need to serve them. We will do that, and we are committed to that.
Yeah, amazing. Nice to hear these words. It really is. And I think what's so important is to have passionate individuals such as yourself that really live and work so hard in this healthcare industry and want to make a difference in South Africans' lives. Because I don't think we realized as the days ticked by during COVID how important the healthcare sector was. I mean, we've always known it, but this was the pillar that we looked towards to assist us when we needed oxygen, when we needed beds, when we needed doctors, when we needed assistance. We were desperate, and it was passionate individuals such as yourself that were there to save lives. Because at the end of the day, that's what you do. You're signing up to save lives in the healthcare industry, and we thank you for that. We really, really do. Ahmed, today I really want to find out what are we hoping that those that are tuning in to this summit, what do you want them to walk away with?
So Leanne, I'm truly humbled actually with when we reached out to some of the speakers that we'll hear today from. I'm truly humbled about the excitement and all of them heeding the call to participate in it. And everyone has said the same thing, that this is a fantastic initiative and we need to do more of this to be able to make the difference and have these right conversations. So there's so much that we can talk about, as you've referred to. That can keep us going for probably days on end about how to achieve true reform in this country. But we need to start somewhere. And so the way we've structured it is in a way where we focused on 3 themes through the course of the day. The first one, we cannot have this conversation without talking about COVID firstly and the impacts thereof. So we'll get some deep insights on COVID, but more from a forward-looking perspective as well, based on what we've learned, where we're going to, and what needs to change. Then the other aspect that we need to deal with is this element of burden of disease in the country. We have a sick population, and it's not getting any better, Leanne. And so we'll spend a bit of time talking about the burden of disease and what needs to be done to be able to address the burden of disease so that our kids have a better future in 15, 20 years' time as we progress through this. We'll hear from the minister as you've outlined earlier. And then quite pleasingly, following the minister, we'll have Dr. Imtiaz Suleiman join us that will really speak about things from a humanitarian perspective. So while we get caught up in policies and procedures and bureaucracy sometimes, somebody on the ground needs to hit the road running and get it done. And that's what they do. And I suppose that will probably just bring us a little bit down to earth to an extent. What we're really hoping for is that we can take out certain nuggets from this that we can workshop further going ahead. This cannot be done by the public sector. That cannot be done by the private sector. It will take all of us to pull together and really make a difference. And that's what we're really hoping for and wanting to achieve following today's summit.
Yeah, I want you to elaborate a bit more on that, because that, I think, is what you've just summed up there is probably the most important point, is the partnerships between the public and the private. Is this what we're aiming for today?
Absolutely.
Yeah.
Leanne, as a country, we do not have the financial resources to tackle healthcare as a public sector on its own. We're going to have to do this together. We have working models, and this is not just about commercial gain. It's not about Afrocentric or any of our other competitors. This is about doing right by South Africans. That's the essence of what it's all about, right? And that's where we need to come together. And we've seen everybody put their commercial agendas aside during COVID, get together, dedicate resources, significant resources at that, to be able to provide, whether it was vaccines, supply, and all the facilities that's required, both public, private, PPE, etc. All of it came together in a phenomenal way that allowed us to get to where we are today, seeing the end of level 1.
Amazing. I think that was one of the most exciting addresses
Absolutely.
all of us were waiting for last night, just to hear what the president had to say, and if we can get something of a life back, which I think it really does. It certainly does look like that way. One of the issues I know that we're going to focus on quite a lot today, and Dr. Anna, if you'd like to speak to it, because you and I were having a little bit of a conversation in makeup, and you were telling me how, I think it's your daughter who has gone and studied clinical psychology.
Yes.
So healthy mind, healthy body, healthy nation.
Yes.
We know, and that's one of the things we're going to focus on today, which again I'm also looking forward to, is the anxiety, the depression that has come out of this.
Yes.
Mentally, this has had a huge toll on us as a nation. Focusing on healthcare, how important is healthcare for our health industry?
I think it is just critical that we balance all elements of our wellness. So I would say that it is very critical that we also attend to that. And as you mentioned, the mental issues, we all suffered also from mental issues, one way or the other.
Yeah.
So we do need a well-balanced life to be able to live a healthy lifestyle.
Yeah, it is. It is so important because, I mean, Ahmed, as we start wrapping up the conversation, I know that for you, when we had our very first briefing, was one of the keys that we needed to focus on is that the toll that will be left behind. I mean, we've been through a roller coaster ride for these 2 years now that I don't, like we said in the intro, nobody could have imagined this. And getting our minds healthy will help our bodies. So there will be a big focus on that today as well.
Absolutely. So we'll see a big focus on mental disease
Yeah.
to the extent of the impact that that has had on it. We'll talk about primary care as well, which is quite significant and important as well, Leanne. Primary care can really get to the nub of the challenges that we sit with within this country. You know, it's one of the things that I liken to if you talk about education, you cannot solve the education crisis in the country by focusing on tertiary. You need to go all the way to the primary level, grassroots level. And similarly with healthcare, we need to start somewhere. And so we'll have to start also at a grassroots level on primary care, building up nurses and the skill sets required through the young kids, aspects of nutrition as well.
Yeah.
You cannot teach somebody that's hungry. So these are aspects that we're going to have to think about how we solve it. Are we going to solve it all next year or in the next 3 years? No, this is a long game. But if we don't start somewhere, we'll never get anywhere.
Absolutely. And this is where we start. And that's what's so important about today, is that this is a brilliant start to talking about these very, very important issues. So I'm going to get a final parting shot from you. I know we're going to hear from you right at the end again, but I want to just to give to those that are tuned in and sitting there. Perhaps, Dr. Anna, I'll give it to you. What are you wanting them to take out of this today, from your perspective? What is the important takeaway that we want for the healthcare sector and from bringing all these professionals together today with your name behind it, Afrocentric?
Well, I would say that COVID has taught us one thing as a nation, let alone as healthcare workers, that we need unity. We need collaboration. We need to have a common purpose that we all work towards. And I'm sure you have seen with this summit, we really intend achieving that. Having all role players, I mean, Ahmed has touched on one, for example, nutrition and all those issues, because you can't take medication in an empty stomach. We know with tuberculosis medication and all other medication, you need proper, adequate nutrition for the medication to work in your body. So we have seen that there are many elements of healthcare, and we need to pay attention to all of them if we are to have a healthy nation. And Afrocentric will play its rightful role in society, because we are here to serve the broader society and broader nation, and not only just our clients and our customers. We have a role and a responsibility as a responsible corporate citizen to do that.
Amazing. Ahmed, for you, last word.
I'm firstly grateful that everybody has joined in, and I think for me it's exciting that, and really with the hope that we'll be able to pick up on some of these deep conversations and follow through on it as well. And we invite everybody in the industry to participate in this along with us. I think we do need to, as I said earlier, put our differences aside sometimes. We need to put our objectives of financial gain aside and actually think about where do we start really assisting to the extent that we can roll our sleeves up and do a lot more for this country. So really excited and grateful to have the participants that have joined us today as well.
Amazing. Well, there we go. Thank you so much, Dr. Anna. Thank you very, very much. Ahmed, thank you. I know you're going to be hanging on and watching every word that's given here today, and we'll hear from you right at the end. So with those words, ladies and gentlemen, what an absolute pleasure it is for us to declare the inaugural SA Healthcare Industry Summit for 2022 open, and let us hope that this is just something that gets bigger and bigger and bigger as the years go by. All right, so now before we start with today's lineup, I'd like to let you all know that today is all about engaging each other. It's about talking and conversation. We want today's proceedings to be very interactive with you, our viewers, taking part in the conversation. So there will be 3 panel discussions today over the course of, well, as I say, of the course of today, and I encourage you to send any questions that you might ask our speakers. So while they're speaking, feel free to put in a question that you would like to be asked, and after they have spoken, we will then sit down and have a little bit of a conversation. So just put those questions in the virtual chat room and we'll be able to get those questions and pose them to the speakers. And even during the panel discussion, if you'd like to throw in some more questions there, please do. I will pick them up and I will pose them to our panelists. So looking forward to it.